Thank you. Good morning, good afternoon, good evening po sa lahat. Saan mo pong panig kayo ng mundo naroon. Welcome to our 213th webinar or episode po of our Health Updates webinar series. Thank you for being part of our credible online community, and to all those who just discovered us today, welcome po. At sana marami po kayong matutunan sa very important topic na hindi po masyado na pag-uusapan sa araw na ito. Ito po ay cervical cancer. It remains a significant public health concern in the Philippines despite advancements po sa healthcare. Pag-uusapan po natin sa araw na ito, epidemiology sa Pilipinas, ano po yung mga prevalence rates, socioeconomic disparities associated with this condition. Our panel of experts will also discuss po ano po yung role ng human papillomavirus as a primary cause of cervical cancer, ano po yung effectiveness ng HPV vaccination program in reducing the incidence of the disease. Very important po ang prevention and early detection, lalo na po para ma-mitigate ang impact of cervical cancer. So we'll be discussing pap smear, HPV testing, benefits of HPV vaccination, hindi lang po sa kababaihan, pati rin po sa mga kalalakihan. And we'll also discuss po maybe strategies and the challenges being encountered in terms of improving access to cervical screening services, particularly in underserved communities. And then finally, we'll also discuss po the range of treatment options for this particular condition. This is the Health Updates program, and I am your host, Dr. Francis Sarmiento. Always a pleasure to be with all of you during our regular Friday, and also my pleasure and honor to co-host this program with one of our program stalwarts, Dr. Stella Mariose. Ma'am Stella?
Good afternoon, Doc Raymond. Welcome to our participants here in the live broadcast of the Zoom webinar and all those watching via live streaming on TVUP YouTube channel, as well as the UP System Facebook page, the TVUP Facebook page, and the TVUP Signal TV channel 101. Our guests for today, our panelists are very prominent figures in the field of OBGYN. We have Dr. Cecilia Ladines Lave and Dr. Lily May Cole. Our new program is now called Health Updates. We have done a little bit of reformatting for our program, but we are still maintaining the same high quality and then leveling up to take a closer look at existing and emerging health problems in the Philippines and in the rest of the world. So for this year, we want to get immediately to the heart of the problem. And so our program is now 1 hour shorter. So we're only on for 1 hour. But sit back, relax, and listen to our lecturers. And I assure you, they are very excellent lecturers. So back to you, Raymond.
Thank you, Ma'am Stella. For today po, before we dive into paano po ba natin marireduce ang burden of cervical cancer and how to improve health and well-being of the Filipino population, we'll go into our person on the street video. Person on the street video is what our very hardworking team behind the scenes are working on week in and week out. Very short video to set our discussion into context, what people on the ground already know about the topic at hand. So for this video, we interviewed several people po, and the questions are, ano na po ang narinig ninyo tungkol sa cervical cancer? Kayo po ba ay nakaranas ng magpa-pap smear? Ano po sa tingin ninyo ang kahalagahan ng prevention and then yung early detection, katulad rin po dito sa pap smear? At may kakilala po ba kayong na-diagnose na ng cervical cancer at paano po siya gumaling? Please watch this.
Cervical cancer, it's a form of cancer na specifically for women na, I believe. It affects the cervix, and I think it starts when the woman gets infected by a specific virus.
So I'm aware of that. I think some of the people that I know parang campaign about it. So I got myself vaccinated a few years back already.
Sakit ng babae na nakakamatay? Medyo prone talaga yung mga babae dito.
Ako, never ko pa na-try, pero I know my mom and similarly other women who are a bit more mature in age get it routinely kapag may checkups.
I personally have undergone pap smear. So yeah, I do it annually because of the annual physical exam and the office. When I reach the age of 35.
Ako actually, nagpapa-pap smear ako. Twice a year kasi yung pap smear dati. Pero ngayon hindi na. Pero ako nakaranas magpa-pap smear kasi yun daw yung makakatulong para ma-diagnose yung kung nagkakasakit ka na, nagkaka-differential na yung matres mo.
I think in terms of sexual reproductive health of women, it's essential na one, it's done regularly, and two, na it's accessible because I think pap smear is the type of exam done to be able to detect kung dun sa reproductive organs ng females merong any anomalies and such. So cervical cancer, I believe, can also be detected through that test.
Naglilinis ito ng na matres. Tsaka dito na, ayun talaga yung pinakaalam ko, naglilinis siya, nakakatulong siya para malilinis or matetrace yung sa kung may magkakaroon ka ng sakit or maiwasan.
Yeah, so I think it's detecting a sickness if in case it happens to anyone. So it's an annual thing, especially if you're prone to it. You have a lot of sexual partners, etc. So it's very important that you get yourself checked.
Actually, meron po, yung tita ko po, namatay siya dahil cervical cancer. Pero mga ilang years na rin po. Matandang dalaga po kasi siya. Tapos, nagtatrabaho sa mga madre, kaso nga lang, parang late na rin na-trace na may cervical cancer siya, stage 4 na agad. Parang talagang sobrang yung grabe na yung mga side effect, yung sobrang sakit na, dun pa lang siya nakapag-check up talaga. Tapos, yun na yung parang stage 4 na agad. Parang a month lang, namatay na siya.
Thankfully, wala naman niya.
Personally, none.
Maging aware talaga, lalo sa mga babae. Kasi importante rin na mahalaga din sa atin yung health natin. Tapos syempre, mas maganda yung mas maagapan kaysa malala na bago ma-trace.
Thank you so much, TVUP. Always eye-opening para po malaman po natin kung ano po yung alam po niya. May mga nakaranas na po, may mga hindi pa po nakakaranas. So, we're hoping that this webinar will be somewhat similarly an eye-opener, but something that will help us get more and better information patungkol po sa cervical cancer. Before we proceed with our webinar proper, we'll have just a little bit of housekeeping. All those who are asking, certificates of attendance have been given out na po. So those who have watched at least 50% of the webinar duration have already received their certificates of attendance. I think there's only one who is asking for a change in the name. Just if there are any questions po, please feel free to email us at our up.edu.ph email account. For our webinar for this week, again, we'll be having standard panel discussion format, which is after our speakers have presented. That will be followed by a Q&A session. So we'll get the ball rolling right now, and Dr. Stella will introduce our main speaker for today's episode.
Our main speaker is Dr. Cecilia Ladines Llave. She is a JPIGO consultant. JPIGO stands for Johns Hopkins Program for International Education in Gynecology and Obstetrics. She is also a Success affiliate of the Johns Hopkins University. Success stands for Scale Up Cervical Cancer Elimination using Secondary Preventive Measures. So also, she is a research professor at the Institute of Child Health and Human Development at the National Institute of Health, and is a gynecologic oncologist and cervical cancer elimination advocate. So let us all welcome Dr. Cecilia Ladines. Ma'am, take it away.
Good afternoon. Thank you very much, Stella, for such kind introduction. And Do you see my slide now?
Yes, it's clear, ma'am. Go ahead.
Okay, thank you. It is full screen already. So first of all, I'd like to thank the organizing committee for this wonderful honor to be having this presentation on cervical cancer elimination. Okay, so today I am going to present to you the reflections on advances in HPV DNA screening, JPIGO, the affiliate of Johns Hopkins Success Program. And for this, we will be focused on the 3 screening methods that are being used to detect cervical cancer early. Number 1 is your visual inspection acetic acid. In Tagalog, ito po yung suka na nilalagay sa cervix. Now, with just putting suka, you will know already na mayroon ng nag-i-start na lesions sa cervix. Then you have the usual pap smear. And the newest one is your HPV DNA testing. And all of this will be linked to early treatment using your ablation, whether thermal ablation, cryotherapy, and excisional procedure using your lip and your conization. So I would be starting with the global cervical cancer context. You know that cervical cancer is one of the most common cancers worldwide. 9 out of 10 new cervical cancer cases occur in low-middle income countries like the Philippines, where there is limited access to vaccination and to screening. And we have around 604,000 new cases every year, and more than half of them will die of the cancer on the same year. And the problem is that if you are a woman with HIV, there's a 6 times more likely that you will develop cervical cancer than those with an HIV negative peers. For our country, having 111 million population, 4 out of 10 are females more than 15 years old who are at risk. In our country, there are this is the 3rd most common cancer among Filipino women, and number 1 is the breast. Around 7,190,000 are diagnosed every year, and 3 out of 4 are diagnosed in the very late stage. That is why 68% of them will die in the same year of the diagnosis, because the diagnosis is very, very late. Less than 10% of our eligible women have been screened, and less than 50% of the facilities have screening services, and even fewer with treatment access. If you can see this table, although it's very heavy, I just wanted to show that the review of the Department of Health had shown that using the visual inspection acetic acid, we were only able to screen less than 1% of the Filipino women who had been screened. It's in year 2023, we had only screened 0.44% using VIA. But for the study that had been done in the Philippine General Hospital, about 7.7% had been screened using your VIA plus the pap smear, but this time including also the private practitioners and private hospitals, but still very low, only 7.7%. And if you're going to look at the number of vaccination that we have, which was started in 2015, it's also very low, to only as much as 2 to 10%. And we started only in 2015 with 20 provinces vaccinating adolescents 9 to 10 years old and to 14 years old. But now in 2023, we have increased that. However, you can see here that still our vaccination is very low for year 2023, we only have 2 to 3%. So you can see the decimal number of what we're having. So that is why it's very important for us to understand the gap. We still don't have a very organized implementation of cervical cancer prevention and control, although we already have started up. We lack practitioners to screen, diagnose, and treat precancerous lesions to prevent cervical cancer. We need to increase the training and the knowledge for early detection and prevention of cervical cancer, as well as improve our cancer facilities. There are only 42% of all the health facilities having the screening. And if you look at the number of cancer facilities, there are only around 10%. However, with the rise of the National Integrated Cancer Control Act in 2020 and the universal health care, we are now seeing a movement in increasing the number of cancer facilities. But it's also very important for us to increase women's awareness with regard to cervical cancer because it's a very, very preventable disease. The goal of the WHO is a world without cervical cancer, about 4 cases of cervical cancer per 100,000 women years. And so the target for 2030 is for us to come up with a miracle 90, 70, and 90%. 90% of the girls who are less than 15 years old, 9 to 14 years old, will have vaccination. Other countries had also started vaccinating the boys, but we cannot still afford that. So we just started with girls who are 9 to 14 years old as our primary prevention, which is mean before you even get the disease, we will already start vaccinating our children so that they will not get the cause of the cervical cancer, which is a sexually transmitted disease, and to teach our children and the lay on the sexual education and healthy lifestyle. For the second goal, which is 70% of the women should be screened using the high-performing test, which is your HPV DNA test, at around age 35 or 45 at least. And 90% of those women who have been screened positive will repeat immediate treatment for the precancerous lesions or for the invasive lesions as part of the tertiary prevention. So our goal is to have a 30% reduction in mortality from cervical cancer by year 2030. So we need everyone's help. We need all of you to understand what this is, what this cervical cancer is. So as a review, as you can see here on the left side, when you talk about cancer, it means the cells becomes abnormal and the abnormal cells multiply. And when they multiply, they become a mass or a tumor, and it becomes invasive cancer, and they affect the intervening organs beside it. And so it can progress and become very, very big. Now, if you look at the anatomy, it's only the woman who has a cervix, no? And if you look at the vulva, you have 3 openings. You have the urethra, the vagina, which goes inside the cervix and towards the uterus. And you have the anus. So when you're standing straight, you can see that in the middle of the hypogastric area, you have under the bladder, your uterus, yung bahay bata, and then you have the fallopian tube and the ovaries, and at the end of the uterus, yung bahay bata is your cervix. And that is the area when your husband have a sexual contact that is being affected. No, that's the cervix. Now, when you are standing up on a lateral position, you see that at the back, you have the bone, you have the pelvic bone at the back, And anterior to that is your intestine, your rectum. And anterior to that is your uterus that goes down to your vagina. And anterior to that again is your bladder. Why am I emphasizing to you this anatomy? Because it's very important for you to understand that the cervix is very near the bladder and the rectum, and that the roof of your vagina is the floor of your urinary bladder or urethra, and the floor of your vagina is the roof of your rectum, which only means that if you have a mass in the cervix and it becomes very, very big, it's gonna eat up the entire vagina and create a hole to the bladder, and you will have a fistula, and so your urine can go to the vagina. And for the rectum, it can create a fistula so that your stools can get out of the vagina. But this happens only when you are in a very late stage. So don't let it happen like that, because it's very depressing to have those, no? Now, and if you look at the cervix, it's important for you to understand that the cervix looks like a donut. So it's a rounded thing. In the middle, there's a circle where you have the external os of the cervix. And if the os is very round, okay, you know that that cervix is still a virgin. No baby has come out of it. But if the woman had already delivered a baby, you'll find that the cervix is shaped like a smiley, because she's already a fulfilled woman having delivered a baby. So this is a normal cervix. One is virginal and the other one is parous. You can see that the cervix in this picture is already a parous cervix. Now, if you have a cervix with a polyp, this is how it looks. This is still benign. If you have a cervix with metaplasia, this is still benign. Now, when you talk of metaplasia, it only means this is also a benign change. It only means when the woman starts to have puberty, your cervix becomes bigger. And so therefore, when it becomes bigger, because also of the hormones, your cervix will evert out, such that part of your endocervical canal will come out into the vaginal cavity. So part of the endocervical canal, which is the lining is columnar, will be exposed to the vaginal secretions, and your lining from columnar will become squamous. It's called squamous metaplasia. And this is a benign change, and this is how it looks. However, if you have this picture on the upper right, you have a white epithelium. This is when you put acetic acid or suka into the cervix, your area with the lesion will become very, very white, parang kilawin, and that the whiteness is raised. And the raisedness will have a border which is very well delineated. And so if you have a white epithelium after putting suka into the cervix, this is a positive visual inspection acetic acid test. And it only means you are starting to have a lesion there in the cervix, and therefore it may be already a pre-malignant lesion, and you can decide to treat this women already. You then have to wait to do a biopsy. As long as you know this is not positive for cancer, you can immediately treat. And when you have cancer, this is how it looks. You're in the lower right corner. You have a nodular cervix, which is hemorrhagic and necrotic. Now, if you see a cervix like this, you suspect already cancer. If you suspect cancer, do a biopsy immediately. You don't have to screen, because you don't need to screen. Bakit? Ba't may screen? Nadyan na nga eh. Okay, duda ka na ng cancer, screening yon, di na yon, no? Ang screening kasi is parang pregnancy test. Long before your abdomen becomes boom boom, alam mo na nabuntis ka kasi ang pregnancy test mo positive kahit wala ka pang nararamdaman. Ganon din ang VIA or acetic acid test. Wala ka pang nararamdaman, alam mo may nagsisimula ka ng cancer kasi positive ang iyong acetic acid test. Now, we know the cause of cervical cancer. It is one of the most preventable cancer. Because sa tatlo lang cancer sa katawan natin, ang alam natin ang cause. One is hepatocarcinoma due to the hepatitis virus. Then you have the HPV virus for the cervix. And then the third now is your gastric cancer. Now, for cervical cancer, 99.7% of the time, it is due to an infection called HPV or human papillomavirus. So when you get an infection, you get the infection, but you don't get the cancer immediately. It takes 10 to 20 years before that infection can become cancer. And therefore, there is a very long window of time for you to be seen by the doctor and for the doctor to see you and know that you might have cancer, and therefore we will try to stop it so that it will not progress. That's the wonderful thing with early diagnosis and treatment, so that you will not die from cervical cancer. So the risk factors of cervical cancer or early sexual contact, low resistance, grand multiparity, history of STD, and smoking. For the signs and symptoms, what I want to emphasize here is sometimes when the lesion is very early, you don't have signs and symptoms at all. You may have spotting, discharge, slight pain, immediate bleeding after contact. But I will tell you, 18% of the time, those women with stage 3 and 4 doesn't even have signs and symptoms. I remember one of the patients said, Doktor, dapat naman gano'n ang kapitbahay namin na diagnosed last month ng cervical cancer. Aba, isang buwan lang namatay na. Bakit? Wala naman siyang nararamdaman because she was diagnosed already stage 4. And therefore, nung na-diagnose yung stage 4, ang hirap-hirap ng gamutin. So don't wait for late signs and symptoms because we now know how to prevent it, and we know how you don't have to progress from stage 1 to stage 4. And you know that stage 1, dyan lang sa cervix, stage 2 hanggang vagina, tsaka paramedia, stage 3, sa paramedia at pelvic floor, stage 4, pumalat na sa bladder, pumalat na sa rectum, meron ng sa lungs, meron ng sa leeg, at meron ng sa brain. Bakit mo iintayin pang kumalat yan? Pwede namang mapigilan. That is why WHO is now pushing to shift to high-performing alternative tests you called HPV DNA test, which is yung mga DNA test na pag yung parang gusto ko malaman, itong anak ko yan. Kumuha lang ako sa hiblang buhok o konting patak ng dugo sa bukol mukha, sa alam kong anak ko yan. Kasi ang ginagamit ko, molecular biology. Ganon din ang gusto ng WHO. They want to shift from cytology or acetic acid to your high-performing test. Ang advantage ng high-performing test is you can do it yourself. Self-collection. Pwedeng hindi ka na bumuka ka doon sa doktor para magpa-test ito. Ikaw, bibigyan ka lang ng kit. Ikaw ngayon ang kukuha ng iyong specimen from your cervix and vagina. And then you send it to the lab and they will tell you what kind of HPV you have. You have about 150 to 200 types of HPV. Ay, ang HPV po, ang Tagalog, kulugo. So sabi, Doktora, ano ko ba naman? Ba't nagkakulugo pa ako dito pa sa pepe? Pwede naman ako magkakulugo sa mukha, sa legs, sa dibdib. Eh bakit dito naman sa pepe pa ako nagkakulugo? There are about 15 types of kulugo that can become cancer. So yun ang hinahabol nito. Ano bang klaseng kulugo ang meron ka?
para malaman ko kung gano'ng kabilis ba yon na pwedeng maging cancer. So yun ang advantage nitong test na to. And how do you do self-collection? Pwede ikaw ang mag-collect. Tuturuan ka namin, bibigyan namin kit, pupunta ka sa toilet o pupunta ka sa IE room. It's either nakatindig ka, na nakabuka ang legs mo, ipapatong mo lang dun sa ibabaw ng toilet, or nakaupo ka, nakaswat, ibuka mo lang yung iyong legs at para maipasok mo sa iyong sa pepe, hindi sa puwet. And then, or nakatagilid ka para lang maipasok mo yung collection kit mo sa vagina. Now, when you put that collection brush into the vagina, titigil yan pag na-reach mo ang dulo ng vagina or cervix. So once it stops there, you twirl it 5 times so that you can get the secretions and the cells. At pag nagawa mo na yon, sa tingin mo nakakuha ka na, hihilahin mo palabas, pag hila mo palabas, itong collection area na yan ay ilalagay mo lalagay mo sa collection bottle with preservative. Itong nakikita mo dito sa lower right corner dito, na ito yung brush, ipapasok mo doon sa collection ng specimen, and ititwirl mo doon kahit 15 times para lahat ng cells na nandun sa brush will go to the preservative. Ito ngayon ang papadala mo sa laboratory. So, ganun ka-easy ang self-collection. So, naintindihan na niyo. So, who should be screened? Ang bagong announcement ng DOH and WHO, women aged 25 to 65 should have screening. But yung general population, you can start at 30, pero pag with HIV, start at 25. If you are using VIA or pap smear, you can do it every 3 years. Pwedeng every 3 years, pwedeng di namang every year, unless gusto mo yon. For the general population, using your HPV DNA test, you can do it only every 5 years kasi very, very sensitive siya. Pero, ang hirap namang na lahat tayo mag-HPV DNA test, ang mahal-mahal baga. This HPV DNA test is 7 to 10,000. Ang mahal. Ang VIA, mura lang yan. 150 to 500 lang yan. Pero pag ang pap smear, pag conventional pap smear, 3,500 sa Asian, at ang liquid-based pap smear ay 3,500. So, ang mahal-mahal pa rin. Ngayon, dahil hindi ka tayo maka-afford, ang plan ng government is first start with the HPV testing at age 30 to 49. If you're less than 30, use VIA, suka lang, kasi ayaw mong pag nagawa ka ng VIA sa menopause, hindi mo makikita ang transformation zone. Hindi ka makakagawa ng VIA kasi hindi mo kita eh. Bakit? Kasi, di ba sabi ko sa inyo at puberty, nag-e-evert ang cervix, namumulaklak yung cervix, kaya nag-e-evert out yung endocervical canal, lumalabas sa vagina. Ngayon, pag ikaw ay nag-menopause, umuoro ang cervix mo paloob. So parang tumitikom na labi. So umurong siya, pag urong siya, yung part ng iyong endocervical canal na lumabas ay papasok na ulit dun sa loob ng endocervical canal. So hindi mo na makita ang transformation zone. So therefore, hindi mo magagawa ng VIA. Ang acetic acid or suka, ginagawa lang kung hindi menopause. Pag you are 50 or more, the best is pap smear kung wala kang HPV testing. Pero pinakamagaling HPV testing. Ngayon, paano pag-collect? Pag ikaw ay magagawa ng pap smear at HPV DNA, is ang pwedeng mag-collect yung doctor, nurse, and midwife. So parang pap smear talaga, nakahiga, lalagay yung speculum, lalagay yung brush, kukuha ng specimen. Pero kung from HPV DNA test, pwedeng self-sampling, and napakita ko na sa inyo kung paano yung self-sampling. Madali lang, no? So, And sa tatlong screening test that we have, yung VIA ay walang dumadaan na test sa laboratory. C lang yan, C. Ibig sabihin, lalagay mo yung speculum do sa cervix. Pag nakita mong cancer, hindi mo i-screen, ibabiopsy mo. Pero kung nakita mo na wala siyang cancer, i-screen mo. Kung walang perimpsyede, you can use acetic acid and lalagyan mo lang yung suka ng acetic acid like this. When you put the suka into the cervix, isusok mo yung cervix ng suka for 1 minute. After 1 minute, lalabas na if there's a lesion, mamumuti yung area na may lesion. So pag namuti yun, nakita mo ang cervix, ang pamumuti is less than 75%, doesn't go to the canal, and it's not very near the vagina, you can immediately treat with thermal ablation. So pero pag more than 75% goes to the canal and the vagina, then therefore you do your excisional procedure. And dito naman sa kanan, makikita mo yung upper column, this is where you do your pap smear. Ganito. Pag ang pap smear at saka HPV DNA testing collected by the practitioner, pareho lang ang procedure. Pareho lang ang procedure. No? And you both put them in this bottle with the preservative and you bring it to the laboratory. Now, this is the sensitivity and specificity of all the testing that we have, HPV testing, VIA, pap smear, and you can see that the higher sensitivity, your HPV testing, and a higher specificity is also your HPV testing. That is why gusto ng WHO, we will shift to the HPV testing. Kaya lang wala pa tayong pera. So an alternative is we can continue VIA and pap smear muna. Pag meron tayong HPV testing, go ahead. Available na to. Mahal nga lang. It range from 4,500 to 10,000 in a private clinic. Kaya dito muna tayo sa VIA and pap kung wala tayong HPV. Pero we're coming up by January that you can get free HPV testing in the pharmacy. So, announce ko if there is one like that so that you can go to those pharmacy na may libreng ganyan para magamit nyo. Now, if you're going to treat, nakita mo na may early lesion pala siya na hindi naman malaki. So gagamitin ko siya ng ablative treatment. Ang ablative treatment is either you use ice, cryotherapy, or you use thermal ablation. Ang thermal ablation, you have a gun, and then you put 1 minute, in 1 minute, you're able to burn the lesion, and you're able to kill the pre-malignant cell. Ang cryotherapy, you freeze it for 12 minutes. If i-freeze mo, yun lang, frozen delight ang cervix mo. Pero ang effect, namumuting ganyan, whether i-freeze mo o i-burn mo. So you are able to kill the pre-malignant lesion. Now, if the lesion is more than 75%, it goes into the internal os, it goes to the vagina, therefore you will do your excisional procedure wherein you have a wire that serves as a knife. And while you're cutting the cervix like that until you reach the end of the lesion that you're taking out, or the transformation zone, that wire also coagulates. So it cuts and coagulates. And so you are able to get a bigger chunk of the tissue so you can have better diagnosis. This cannot be done for pregnant women. No, so importante hindi buntes. So, but then this is also very good if your lesion is very big. Now, I just want to tell you about the Success Consortium in a very short way. This success, as already Dr. Stella had tell you the meaning of it, we piloted the screening linked to treatment in some 30 sites all over the country, wherein we did also implementation research, looking for the evidence for feasibility, acceptability, and cost for screening linked to treatment, and integrated service delivery with treatment referrals, and community engagement in demand generation and scaling up. So these are some of our pictures of our training. Okay. And what did we do? We prepared the site. What we did, we had a quick situational analysis and chose the 30 sites. We had a Department of Health and JPIGA Memorandum of Agreement. We established steering committees, technical working group, joint program implementation. We did ocular visits. We mapped the laboratories and clinics. And then we established the supplies and documentation and monitoring and started the program. And when we started the program, we have different kinds of training. We have training for the practitioners, doctors, nurses, and midwives. We call clinical skills training. We train laboratory and logistic management, community health education. And then we have training for trainers, mentors, and supervisors. And we collaborated with the Society for Colposcopy to have training for colposcopy, leap, and cone. And we're now finalizing our masteral training, who can be able to train all over the country and even send them in the South Asian region to help us train also other countries. So what we did was the assure implementation, service delivery, and research. And with it, we have demand generation, navigation system, monitoring, evaluation, governance, policy, sustainability, and scalability, because we want the government to have a very organized system of program for cervical cancer elimination so that the government can start and continue and scale up the program. For the laboratory, we use the Gene Expert machine that is being used in TB dots and also being used in COVID, but we also worked with Roche having the COBA system for the centralized laboratory, which is coursed through the high precision laboratory. And we are now seeing that some companies like China, the Hybrid Biofoundation, using the molecular biology laboratory. For the past almost 3 years, we had a total of 51,982 screened, 31,633 from the facilities, and 20,349 as an outreach program. And when we looked at the type of HPV, if it is the 16 and 18, which is the most oncogenic, it's only less than 10% each. But if you will put them together with combination, is around 22%. But the most number of the HPV type is your others, which means if we will choose the vaccine, we have to be sure that we're choosing something that would cover most of this HPV. And I think this is my last slide, and I hope I'm only covering 25 minutes. And the key points are for us to eliminate cervical cancer, we need to vaccinate the children, we need to screen women, and we need to treat them when we see them already positive and with cancer. We need to push for a sustained and organized screening program with high population and have high self-collection rate. We have to prioritize HIV-infected women, and we have to expand the screening and treatment options of pre-cancerous cancerous lesions. We have to push for public-private partnership, and we have to push for advocacy, policy, and funding support. And we have to be very organized with monitoring and evaluation, sustainable innovation, and research. And with this, our goal is to eliminate cervical cancer in the Philippines, because it is a disease that is preventable, and it's the disease that can be treated if diagnosed very, very early. And I'd like to thank you very much for your attention. Thank you very much, and good afternoon.
Thank you so much, Ma'am Cecil. Marami po ako natutunan for for cervical cancer elimination. Any comments from Ma'am Stella before we proceed?
Yes, it was a very extensive and very clear lecture, no? So marami tayong natutunan, especially yung kasi din sa person on the streets, puro pap smear yung na-mention, no? Pero there are other methods to be used so that we can detect it early, not only pap smear. Ayun lang po. Back to you, Raymond.
Thank you. Maraming salamat po. Before we call on our reactor, I just like to greet those who are joining us locally po, no? From Davao Regional Medical Center in Tagum, Davao del Norte, Eastern Visayas Medical Center in those from Cebu, Palawan State University College of Medicine in Puerto Princesa, Palawan, Bataan General Hospital and Medical Center in Balanga, Bataan, and May Kawayan Doctors Hospital and Medical Center in May Kawayan, Bulacan. There are also those from LCUP, Malolos, Bulacan. Maraming salamat po. From Bataan, from Philippine General Hospital, UP Los Baños. Thank you so much. City Health Office of Antipolo, University of Rizal System Health Services, Marilao, Bulacan, again from Bataan, from First Gen Corporation, thank you so much. Those from Rizal Medical Center, from the province of Quezon, thank you. And then Cavite, Philippine Heart Center, Quezon City, and the Provincial Health Office of Nueva Ecija. And then internationally, as you know, we are also being viewed from Ryan Hall Shanex Incorporated, Bridgewater, Canada, Island Hospital, Penang, Georgetown, Pulau, Penang, Malaysia, Nam Kanto University Hospital in Kanto City, Vietnam, as well as University of Hail in Hail, Kingdom of Saudi Arabia. So maraming salamat po. We will call again Ma'am Cecil during the Q&A session. At this point, we'll call in our reactor. She is the chief of the section of gynecologic oncology at the Department of Obstetrics and Gynecology, Jose R. Reyes Memorial Medical Center. Please welcome Dr. Lily May Chodoro Cole.
Thank you. Thank you, Ma'am Stella and Doc Raymond. Please bear in my voice, ano. So, sana beauty na lang, ano. Pero yesterday, I literally woke up like this, no, with this voice. So first, no, I would like to congratulate Dr. Alyavin. She has been my mentor, and cervical cancer prevention is your lifelong crusade, no? Nagsimula yan sa VIA, and now we have the top of the line HPV testing. It's still Dr. Alyavin who's leading this program. So thank you, ma'am, for the well-explained lecture. So this was shown to you a while ago, no? So for the first time, no, in 2018, cervical cancer has been put to the spotlight, no, with the global call to action of the UN Director General, no? So these are the targets, no? If you are going to look at the goal, it's in 2030. So we are almost halfway to the target date that we should meet the 90-70-90, no, as explained by Dr. Aliav. So what happened then, ano? So several programs were started by the Department of Health. So we have the intensified cervical cancer screening programs. We go all around to do cervical cancer screening. The vaccine for adolescents were also intensified. And late 2022, we were granted, no, our institution was granted the commission to do the clinical practice guidelines, no, for cervical cancer prevention. And this is our output, no, this is available in the DOH compendium, which you can easily access at the DOH website. So include questions on vaccination dose and screening for cervical cancer, aligned, no, to the universal healthcare, and to be used, no, not only by obstetricians and gynecologists, but also our general physicians, family physicians, nurses, and midwives. So this is one of the questions, no, that was addressed. And sometime in 2020, 2022, this has been the recommendation of WHO. Why? Because we have a very poor uptake of our cervical cancer vaccine. And it has been shown that if it's given to young women, no, the antibody response is as high as those receiving the 2 doses and the 3 doses. And the implication of this is very large in terms of the logistics. So our healthcare workers, no, have to maintain the cold chain for this, no. So it's very, very easy if only 1 dose will be given. So this was shown to you, no, we're way, way below the target of 70%. No? We are not even 1% using the VIA. So it's very, very questionable if we'll reach the 70% by 2030. So what is important in the recommendations of the WHO for screening is that we were asked to transition rapidly, no, from using cytology. Cytology here means pap smear. And you know that pap smear has been here for quite some time, no? Si Papa Nicolau discovered it 1950s pa. The developed countries have been very successful, no, in eradicating the disease using pap smear. But in underdeveloped countries, just like in the Philippines, quite low, the middle income country na tayo, it was not successful because you need an infrastructure for this. And the at-risk population are in the remote areas in our country. So wala pong pathologist doon who will read the pap smear. So this has not been effective. 15 years ago, VIA, or what Dr. Ella was saying, as the acetic acid or the suka test, no, was introduced. But 15 years after, it hasn't really made a dent, no, on the incidence of the cervical cancer here in our country. So hopefully, with the recommendation of HPV testing, we will change the course of cervical cancer. So we are working on the other end, no, seeing these women, no, how come a highly preventable disease is killing women who are in the prime of their lives. No? So we really hope that HPV testing will be the answer to this. As you can see, I put in bold, no, it has to be linked to treatment. Dr. Liave has also mentioned that there should be an organized structure, meaning from the local healthcare workers who have screened, there should be an identified center where this abnormal screening test will be referred to. Otherwise, the efforts for screening will be put to waste. No? So this has been addressed also by WHO. We have the the screen and treat approach. So these healthcare workers were trained, no, how to do the cryotherapy and the thermal ablation. And if there are lesions that goes beyond the requirements for this treatment, they are asked to refer it to a tertiary center. So we were fortunate to be included, no, in the success study. And this is the data of Jose R. Reyes Memorial Medical Center. So we screened, this was in 2022, so it's around 2,500. If you will look at the prevalence of the HPV positive, it is within the average of 10 to 12%, no? But if you will look at those who did not come back, no, even for assessment, 42%. So we've been calling them up, no? So for some reason, they do not want to go back, no, for assessment. And I think this is a problem that needs to be addressed. No? And we need to empower our local healthcare workers in terms of counseling. No? Kasi sayang, they were already identified by the test, no? But they did not pursue the evaluation and the management. So, from modeling studies, so bakit HPV testing, no? As mentioned, it's very, very expensive, no? So yung modeling studies of WHO have shown that if a woman is screened, no, once, no, just once, no, it decreases her risk of dying from cervical cancer by 70%. And if she does that, no, kahit 2 beses lang, no, at this age group that was prescribed 30, 49 years old, it drops to even more than 85%. So a lot of advantage, no? So it's a test that is an answer to that type of attitude that our women have. They do not really go to the hospital, no? When they are well. They only go to the hospital when they are pregnant, when they are bleeding profusely. And I think this will be the answer because you don't need to go to the healthcare worker, no, every year. So, and there is an advantage even going once in your lifetime. So the other advantage of HPV is actually the simplified collection. So Dr. Aliaves also mentioned about the wide acceptability of self-collection. So ang mga Pilipina na ayaw nila that they will lie down, no, and do the lithotomy position, no. So they are very shy. So culturally, we are shy. The women are shy of having their reproductive organs examined. No? So that's why this is another advantage. Yung pap smear po, we cannot do it without these women, without the healthcare worker doing the procedure. So other advantage would be this is ideal for mass screening, no? So it's not labor intensive for the healthcare workers. Why? You can do the counseling, so en masse, no? So you gather all these women and you counsel them, you tell them how it is collected. And there is these capsule tents that are provided and they will do the collection there. So hindi rin mapapagod ang healthcare workers for this. Why? So kung imagine niyo yung ganyang kadaming women, they will go one by one, they will lie down, you have to arrange all the equipment, and then you get the specimen. So mas madali. Next, no? So as mentioned by Dr. Aliave, so with the pandemic, no, a lot of hospitals acquired the gene expert machine because this is the machine that's being used for COVID and even for TB. And this machine can also be used for HPV testing, no? So, dahil marami na yung nakatengan itong mga machines nito dito hospitals, no? These hospitals just need to buy the HPV kits and the cartridges, no? And they can provide the services for HPV testing. And hopefully, if that is done, it will lower down the cost of HPV test as a screening, no? The results are also fast, no? The test can be done after 4 to 6 hours. Although you have to give time also for the technicians to release the results, no? Pero mabilis lang yan if ever there is what is known as a political will. No? So obviously, these women, kung yung pap smear nga before, they cannot afford it, ano? What more with HPV test, no? That would cost around 5,000. So I think we are in for a change. There are game players with a much more cheaper test kits, no, for HPV testing, no. So hopefully we can offer this test for our at-risk population. So there is another problem, what will we do for the high-risk HPV positives? So baka naman ma-overwhelm yung mga hospitals, no? So as mentioned, the average for the prevalence is 10 to 12%, no? And from a Netherlands study, it says that only 0.5 to 1% would be CIN3. So masyadong madami yung echocolposcopy. This is the machine that we use, no, to identify if there is abnormal areas in the cervix, no. So obviously we need another pathway, no, so that only those showing high-grade lesions will be referred to the specialist. In Netherlands, the target referral rate is 2%. So 2 to 4 colposcopies per CIN. CIN3 here means high-grade lesion that is detected. So I will end up with this, no? So I saw this proposition by an author, no, a vision to the future. So if you will look at the at-risk population globally, it's 1.5 billion. So it's impossible to screen all these women, no? And come up with 70% by 2030. In our data, it is 33 million, no? So with the use of HPV testing, no, hopefully, the target population will be addressed, no? So these are not as mentioned before, these are not the women that go to the hospital, no? These are the women who are in the community who don't go to the hospital. And I think the barangay healthcare workers will play a lot of role in this, no? In terms of convincing these women to undergo the test, no? So what we need to see the hospital are those with abnormal testing, no? And those with the disease, no? So he was saying that with the AI, no, around the corner, we might be coming up with machines, no? Digital colposcopes. I don't know, Dr. Liave, if the cryopop would be included in this, ano? But with AI and with the pulling of the pictures, ano, it will be easy for the healthcare workers, no, to just use these machines, ano, and it will tell you which ones are low-grade disease and which ones are high-grade lesions. And low-grade lesions will be addressed by this trained local healthcare workers, no? And the tertiary centers and the hospitals will be decongested, and the specialist will be doing only the treatment for the high-grade lesions. So with this, I would like to end this reaction. So I hope I added and to the very comprehensive lecture of Dr. Eliav. Thank you very much.
Okay, maraming salamat po, Dr. Lily May. In the interest of time, we'll be asking our questions. Maybe we can ask our speakers po to open up their videos as we maybe get one or two questions. Ma'am Stella, maybe you can start off with the first one.
There was a question in the chat box about a 14-year-old girl who had already 2 doses of the HPV vaccine. So the mother was asking if she needs to have additional. I answered her question already because in our infectious disease division, it was said na 40-year-old hanggang 2 doses okay pa daw. Di ba tama yon, Ma'am Liave and Lily May? So tama yung answer ko doon sa patient na nagtanong. Ang second question from Dr. Joseph Tortona, if the patient already has cervical cancer, kung dapat ba daw should she be vaccinated still? So sinagot ko siya, sabi ko no, because the patient already has cancer. I hope that's correct, Ma'am Liave and Lily May.
Yes, ma'am. Very
Baka meron pang gusto magtanong. From you, Raymond, baka may nagtanong din sa'yo.
Wala naman po dito. Baka Dr. Cecil and Dr. Lily may want to add to your answers po para lang po masagot din po.
Si Ma'am Llave, Ma'am.
Well,
Oo.
Papers? Okay, anyway, would like thank you very much, Dr. Stella. She's also a very good expert where it comes to cervical cancer prevention. Being an infectious specialist, she had a lot also of experience on vaccination and even screening. I'd like to thank you for your answer. So she's right that the 2 doses is enough. No, we are just trying to see now whether we will shift to only a 1 dose. We don't know yet. It's still in the process whether our country will go for a 1 dose only. Some countries are already doing the 1 dose. So, but we don't know yet. We'll still await for further studies. So, yun lang, nilabas ko lang yung promise of the 1 dose. Otherwise, wala namang ibang additional. Dr. Stella had answered it very well. Lil May?
Agree, ma'am, na as of now. And very fortunate, no? Because the vaccine is also expensive, no? But it's offered by the, no? By the LGUs, no? And the Center for Health Development. So, I hope na yung mga adolescents, they are the best, no? The best ones to be vaccinated because they have a very high antibody reaction. So, I hope you will bring your adolescents to our health centers.
Last na to, Raymond, ha, kasi si Ma'am Llave, they had a project before, nung hindi pa nagpa-pandemic, yung children, binibigyan ng free vaccination. Ang problema lang, nung nag-pandemic, yung mga moms, hindi nila dinadala sa mga health center yung kanilang anak for the vaccination. Dr. Llave, ano na nangyari doon sa project ngayon, ma'am?
Yung project ng vaccination, we even have the mother and daughter initiative, diba? Yung mother and daughter initiative is that we screen the mothers and they bring their 9 to 14-year-old adults for vaccination. We finalized that project in time. And it was a very good strategy. Kaya most of the meetings that we're having with DOH and some with the stakeholders, they would like to have programs which they call mother-daughter initiative, wherein the mothers get screened and they bring their children. Ang problema when they bring their children, pag may pasok, ang health center bukas lang naman ng Monday to Friday. So parang nothing can compete with the school vaccination. Kasi sa school, Monday to Friday, you can do the vaccination. Sa health center, alam naman pumunta ba yung mga bata? Papunta sa health center. Unless yung health center pupunta sa school. So yun. But we finished that project already, my love. And it's a very good result. And yun na nga yung maganda doon, yung mother and daughter initiative. Both mother and children will be vaccinated. The government is giving the vaccination for free in government public schools for children grade 4. Usually it covers the 9 to 14 years old. They also have programs for out of school youths pero parang naka-coordinate sa community, no? So, swerte yung mga government schools na libre yung mga adolescent. They said that if we have more money, it will be course to PhilHealth. So, pag na-course sa PhilHealth, pwede ng HMO pumasok para libre na yung bakuna. At saka, who knows, with the pag bumaba yung bakuna, the government can be able to already give it free for all the students na grade 4 muna. Grade 4 lang muna. Yun yun. Thank you.
Alright.
Back to Raymond.
Thank you. Maraming salamat po again to our gynecologic oncologist po, no? Dr. Cecil Ladines Lave and Dr. Lily May Chodoro Cole. At this point po, we'll be putting up our evaluation poll. It's 5 statements, 4-point Likert scale. I'll read through it and we encourage everyone, especially here in the Zoom, kung nanonood din po kayo in the playback at also sa Signal TV Channel 101, maraming salamat din po. Number 1, the panelists demonstrated thorough knowledge of the topic. Number 2, the panelists were well prepared and organized. Number 3, the panelists spoke clearly and audibly. Number 4, the panelists used appropriate language or technical medical jargons adequately explained. And finally, the panelists contributed to new perspectives and knowledge on managing various key health issues. So we'll be opening this po, no, keeping this open until the end of the webinar. For next week, Ma'am Stella, what do we have for next week?
For next week, we have a very interesting lecture also about breast cancer. So dumadami na ang breast cancer patients and we should learn about this so that it can be prevented.
Okay, maraming salamat po. Before we conclude our program, all health updates webinars are archived for viewing at the TVUP YouTube channel. So you just go to www.youtube.com/TVUPPH and you'll be able to see in the live tab po, no? All 212 webinars. After today will be 213th. Also, in the same TVUP channel din po, you'll be able to see in the shorts tab yung atin pong health updates shorts. So hopefully that you find it very useful, very valuable, have nuggets of wisdom that you'll be able to extract po, no? So something that will be helping you tide over, especially if you're just waiting for someone po, something interesting and something na information field po natin. So this formally closes our webinar for the week. Magkita-kita po tayo again next Friday from 12 noon to 1 p.m. It's a date.
Together, we can stop preventable deaths.
So keep safe, keep healthy, and see you online.
Thank you very much po. Good afternoon.
Thank you, ma'am. Thank you, Lily.